My name is Ashlyn Duncan, and I'm 28 years old. My mother, Ramona, is the ERCCU director there at Ashley County Medical Center in Crossett. Heart disease is a silent killer in women of any age. Mine started at the age of 6 when it felt like my heart was going to beat out of my chest. And so the doctors at Children's Hospital put me on propranolol, and so I was on that for a few years, and it worked during that time. At the age of 15, I was at dance in high school, and my heart started beating crazy, and I collapsed. And so I went to see a cardiologist, who then put me on a 24-hour Holter monitor and then a 30-day Holter monitor, and discovered that my heart rate was getting over 200 beats per minute while I was sleeping. And so my medication was then adjusted, and then that worked for quite a while. And so I was on that regimen for a bit until the age of 19. At the age of 19, I then went and saw an electrophysiologist who said I needed to get an ablation done because of my SVT. And so when I went to go get the ablation done, they could not complete the procedure because my heart rate shot up over 200s, and I was in AFib. And so it was a scary feeling, and at that young of an age, you don't really know what's going on, and it's just scary. And so I was then put on another heart medication to kind of control the AFib. It is a very weird feeling knowing that you're fixing to pass out. Your heart starts beating crazy, and then you just see the blackness in your vision, and then you just go down. And so that's what happened to me a lot. Pretty much every time it would happen, that's what I felt, the crazy heart rate, and then the blackness, and then I would just go down. And so I was on those different medications. I was on 2 different heart medications. I was on baby aspirin for the AFib. I was on metformin for the PCOS that I was diagnosed with at an early age. I was on desmopressin, and that was for my diabetes insipidus that I developed after having a pituitary tumor removed, and my pituitary gland was damaged at the age of 3. And then I was on some reflux medication because I've always had that as a young child. And so that was my routine for quite a while. And I'm still on certain medications. I'm not on as many as I used to be. I was told at a young age that I would never be able to have kids due to the damage to my pituitary gland. And by the grace of God, I was married. I ended up pregnant, and I have now had 2 great boys who is fixing to be 6 and 2. And they're the best, and I don't know what I would do without them. I see my cardiologist every year now instead of every 6 months, which has been great. My doctor that I see is one that I work with personally. I work with him in the hospital. I see him all the time. He checks on me and makes sure I'm okay. I'm a registered respiratory therapist, and I work in the front lines against COVID here in Northwest Arkansas. And so that's what I've been going through with the past year with COVID. I don't have any problems other than I do still get heart palpitations. Other than that, my doctor has taken me off all heart medications. I still take baby aspirin daily and all my other medications that I would normally be on. But other than that, I'm not on any heart medications, I'm glad to say. Ashley County Medical Center is an excellent hospital. When I was there in the hospital in CCU, which I had been in many a times, the nurses and the physicians were excellent. They were awesome, and they gave great care. And they really take care of their patients there. Heart disease does not discriminate against anyone of any race, any gender, any age. So please pay attention to your signs and symptoms and get some help if you need it. I am a heart survivor and I will do anything to beat this disease. Thank you, everyone.